for my doctors.
Yeah, Epperson was the second season.
Okay, check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
What about Dr. Alsip's?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
2, 3, 4, 5, 6, 7, 8, 9, 10.
Last mic check.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff, along with Mario Martinez, who is the Assistant Director of Metro Health here in San Antonio, and Dr. Brian Alsip, who is the Chief Medical Officer of the University Health System. This is our update of COVID-19 in San Antonio. Tonight, we are reporting 1,688 new cases of COVID-19, which brings our total to 33,555 in our community. Keep in mind, these daily case totals are just one thing that we are tracking. You can review more information about overall positivity rate, hospital trends, and onset of illness at EpiCurve at covid19.sanantonio.gov. But I did want to point out one thing. In the 5 days prior to today, ending today, we were averaging over 1,200 cases a day. The previous 5 days, we were right around 600 per day. So clearly we are seeing a surge as a result of that time period right around July 4th. Keep that in mind, because that all goes back to how we handle the behavior and how we handle physical distancing and masking. We also, unfortunately, have 9 new deaths to report tonight, bringing the total to 283. One is associated with a nursing home. They are as follows: 8 Hispanic males in their 20s, 30s, 40s, 50s, 60s, and 90s, and 1 white male in his 80s. It should be noted that tonight we are reporting 2 deaths in their 30s and 1 death in their 20s. We continue to mourn the loss of these members of our community, loved ones, neighbors, colleagues, so please keep their friends and their family in your prayers. Over in our hospitals, tonight we're reporting 1,113 people in the hospital, with 429 in ICU and 287 on ventilators. Those are all down from yesterday, which is a good sign. There are 51% of ventilators available and 12% of hospital beds available, and our hospital system, again, remains under severe stress. Let's put some of these numbers in perspective, though. The graphic you see on the screen is a snapshot of overall hospitalizations. Of the overall cases that were hospitalized, the 0 through 19 age group is made up of average of 5% of overall patients in the hospital. Of those age group, 36% of hospitalized cases are among infants, ages 0 to 2. So this goes to show you, again, no age group is immune from this virus, so please do not risk the life of another person, whether elderly or young, by not following the guidance of our public health professionals. Wear a mask, wash your hands, keep 6 feet of distance between yourself and others, and a loved one, in many cases a child, is depending on you to keep them safe. One last thing before I turn it over to the judge. I did talk about the SG2 model yesterday, so I'd put that graph on the screen. SG2 is a company that produces a model showing projected hospitalizations over the next few weeks. On this graphic, you'll see the black line shows where we actually are with regard to hospitalizations over time. The blue line will show you the projections if the public protected themselves by wearing masks and physically distancing over the 4th of July. We know that that wasn't the case universally, so that would have been our best case scenario. If you look at the green bar, it projects hospitalizations if people exercise no precautions over the 4th of July. So as we move along over the next few days, we think we're going to be somewhere in between that blue and green line, but certainly we are hoping that this plateau remains and begins to decline, and it all depends on how we handle the next few weeks in terms of masking, physical distancing, and personal hygiene. So please do your part. I'll turn it over now to Judge Wolff.
You're correct, Mayor. We have a chance to finally get hold of this thing if we'll hold together and do the right thing. We hit a high point on hospitalizations on July the 13th with 1,267 in the hospital. And in the last 11 days, we've seen a small decline, but not enough to really determine whether we're turning the corner or not. But we've had about a 154 decline in people going in the hospital. Good, but again, too early. But the bad part of that is that we are not declining in terms of people that are on ventilators and people that are in ICU. Maybe a tiny bit of difference, but that's still very high. And those patients are very much at risk. And we hope they're going to recover. But I think there's a couple things we need to remember now. People used to make light of this, and it used to just really irritate me when they say this is no different than the flu. Well, the bottom line is COVID is a lot more deadly than the flu, and it's much, much more contagious and passes very, very quickly. the way it stands today, on average, of about 1,000 people that would pick it up, 10 of those will pass away. So it's still a lot of people that will pass away. But more important than that, in thinking about how we need to handle this, is that if you had COVID, and particularly if you ended up in the hospital, and particularly if you ended up in ICU or on a ventilator, when you come out, the game is not over. There's some long-term health consequences of having COVID. We don't talk about that a lot. People, oh, well, there are not many people dying. What are we worried about? That's a terrible, terrible thing to be saying, because there's a lot more danger to you and long-term health issues with respect to this disease. So, as the mayor says, we've got a chance to turn the corner here, but everybody's going to have to be very careful, doing the things the mayor said: face masks, distancing, sanitation, and staying away from large groups. I think I gave the figure just last night. You go with 100 people somewhere, it's almost certain one of them will have it. You go with 10 people, almost certain about 30% will have it. So stay away from large crowds and do all the things that we've suggested you do, and help us turn this around. Some promising signs, but very little data yet to know whether we've done it.
Thank you, Judge. And we don't hear it as often, but it's still true. We are all in this together, so let's keep working hard. Physical distance, wear a mask, personal hygiene, stay away from large crowds, stay home when you can, and we can turn the corner on this virus. As always, you can check the latest updates by texting COSA.gov to 55000. You can also go to the website anytime at covid19.sanantonio.gov. Mario, myself, the judge, and Dr. Alsip are available for questions.
Sorry.
Go ahead.
No, go ahead.
The FDA authorized the use of sample pooling. Will the city, county be using that?
I think that one's for you, Mario.
I don't know that we're looking at that yet. I mean, there's been some discussion, so I think we can get back to you on that question.
Mayor, do you mind just going back again about the past 5 days and then before that, where we were at?
And so let me put a little asterisk on that, because we did have the one day where we reported that backlog from the state. If we remove that backlog and just look at the daily cases, the 5 days ending today, the previous 5 days ending today, we were averaging 1,206 cases per day. The 5 days prior to that, we were in the 600s, low 600s. So clearly something happened that's spiked our cases. That would happen right around the July 4th break. So, you know, it is a reminder, again, this thing can turn on a dime, for better or for worse. So wear your mask, physical distance, do all the things that the health professionals are telling us.
On that same topic, Dr. Alsip, I'm just curious, because it was 20 days ago today that we had the mayor and the judge and all these hospital leaders, you know, talk about the 4th of July holiday. 20 days later, where are we? I would just like to get your perspective. Are we better? Are we worse? Is this what we were thinking? I know it's hard to predict, but I'm just curious.
Well, I think we're cautiously optimistic. Clearly, as you referenced, the mayor and the judge, I think we're able to, despite some of the challenges at the state level, offer some real opportunity for us to slow down the virus through some of the interventions that were put in place. That said, you know, we still have over 1,100 people in the hospitals. So we've had, the last 6 days, a decline from the previous day of about 5 days, which is a good sign. Both mayor and judge have referenced that in our data. But we haven't seen a steep decline. You know, models are good, and I think seeing what SG2 has shown us indicates we could be on a plateau and maybe a slow decline to come. But we went through a very severe period for the past couple of weeks where our hospitals were under stress, and we haven't eliminated that stress. And so all of us always want to be optimistic, but we have not let our guard down, and we won't. We can't. We shouldn't. This virus can, as the mayor just said, turn on a dime. We can see how rapidly it can occur and how quickly our hospitals can fill. And as we've referenced before on this program, it's not just patients within Bexar County, but outside of our County that come to our facilities, and we've seen the stress that has occurred and still, I think, is occurring in parts of South Texas and the Valley. So we just need to be very aware of those.
In your medical opinion, how far off would we be if we didn't have the mask mandate that was issued by the governor on July 3rd?
Well, I think that anything like that helps, and I suspect if there weren't some of the interventions that the mayor and the judge have put into place in advance of the 4th of July, we would be seeing a higher case count now in the hospitals based on what we would have seen similar to the experience after Memorial Day.
If you look at Memorial Day, I guess that was what, May 31st, something like that. It always takes at least a couple of weeks before you recognize what might have happened. But if I'm looking at June 14th, the number of confirmed cases went from 4,300 went up to over 7,000 within 10 days. So hopefully that percentage-wise, I know we're testing a lot more today than we did then, but you can see the jump right after Memorial Day, and you're seeing some increase now after July 4th. Percentage-wise, hopefully it won't be as bad, but we had a pretty good jump after Memorial Day.
Mr. Martinez, when it comes to case investigation that's being sent to DSHS, is Metro Health backed up on those investigations, and what is the process to get that information to the state?
So currently, we have 116 case investigators, and even aside from that, 12 contact tracers, 3 MOCA. And so currently, we're going to a state system to do the data entry for that, which expedites, how quickly we can go through those case investigations. And so I could say that every day and every week, we're getting a lot better in, going through those. We are adding an additional up to 200 case investigators and an additional 50 contact tracers to help us in that work.
So what percentage of the overall caseload do you think you have submitted versus how much you still need to do?
We'll need to get back to you on that.
And then can you explain how important it is to get those numbers to the state?
Yes. So especially the case investigation numbers and that information, because then the contact tracing can then begin to notify as soon as we get that information into the system. And so, and this is in communities across the state where we're all inputting that information into the Texas Health Trace system. And so it does help us to make sure that we're getting that information to the state, which then helps other communities and our community with the contract tracing as well of the work that we do here in San Antonio.
Mario, we have a related question from Mariah Medina at KENS 5. In what ways has the surge in COVID-19 cases changed this need for case investigators and other necessary personnel as it relates to contact tracing?
Right. So even within our department, we redeployed staff within Metro Health to help with case investigations. And we've also finalized the contract with UT Health, and that's where we're getting the additional up to 200 case investigators, in addition to the additional 50 contact tracers. So those negotiations and the contract with UT Health were already in place as we were seeing the surge, but during that time that we were finalizing the contract, we had already made plans to have our own Metro Health staff, and then others, for example, fire department staff, helping with the surge and making sure that we were doing our case investigations.
Dr. Alsip, I'd like to get your medical expertise. I interviewed a man today in our area who said that he got coronavirus twice, and he said the second time was 100 times worse than the first. Can you talk about this possibility and what it would look like?
Yeah, we don't really know is the short answer. Some of the data that we have, I think that's most available are from places like South Korea, where they actually have ongoing testing at high frequencies. And they've identified individuals who were COVID positive, who actually went through a recovery period, were actually tested negative, and then had a repeat positive. Some of those repeat positives were asymptomatic, and some of those positives were symptomatic. Yet, despite that, at least there's some sort of general consensus so far that we haven't identified a true case of reinfection of COVID-19. So, we've only been dealing with this virus for about, 7 months or so. So the data continue to come in. It's difficult to know whether a second positive is a true reinfection, or is it, again, a persistence of this virus that is yet redetected. And that's not even considering the validity of the test, whether it's a false positive or a false negative at any given time in that series. So some of those data out of South Korea are helpful in guiding those opinions, but we don't have any definitive evidence to date.
So in that sense, it could just, maybe the period could be a lot longer within the bodies where it's not really being reinfected, so to speak.
Sure. I mean, we know the CDC has come out and published that they have seen persistence of the viral particles, certainly the RNA within the PCR testing as far out as 12 weeks. So that's 3 months in and of itself. So we know that that can lead to some challenges in interpreting those data.
Have we seen some of these kind of case scenarios in our area that you are aware of?
Occasionally, I hear of stories of individuals who were tested a second time from a previous experience where they were positive earlier on. So folks that had been tested maybe as early as March or April, again, either had cleared the virus, presumably, or certainly had clinically recovered. And there's generally not many indications for retesting at this point, at least for a positive. There certainly could be for a previous negative. So those are occurring, and we're seeing those more frequently now because obviously we're seeing the disease last for longer periods of time.
Dr. Alsop, I'm wondering, so with contact tracing, everyone who tests positive, if they were retested and they tested positive again, that wouldn't be counted. Is there any way that the city is tracking any of that, or the hospital systems, for your records or information?
Yeah, I mean, I think I could say, having been on the program last week, that actually was a question brought up, and it was clear that the Metro Health is only reporting unique patient encounters, so they're not double counting a positive, and Mario can confirm that. Certainly on the hospital side, since we send by individual patient level data, we have that information as well, so we can see if it's the same patient that was retested. Again, they're not reported as a new case as far as I'm aware.
Yeah, that's correct.
So when it comes to symptoms or counting someone as recovered, if your Metro Health calls somebody who tests positive 3 times, even if they don't communicate with that person, they'll be counted as recovered if they aren't either dead or hospitalized. And so I guess, medically speaking, scientifically speaking, how accurate is that in terms of a person's recovery from coronavirus?
Yeah, so I think what we're looking at is what is that definition of recovered, right? And so what we are saying to the public is an individual who has improved on the symptoms, but also has gone through, 10 days since the onset of the illness. And then, of course, now with the new CDC guidelines of not having fever within 24 hours without using any fever-reducing medication. But to your point about, individuals that we do not contact, we'll definitely need to get back to you on what is that determination under that category of recovered.
Do we have an update on testing? We haven't asked about that in a while, just like numbers, like daily, what we're seeing in terms of how many people are getting tested.
I'll have an update for you on the private labs tomorrow, Henry, in terms of average that we're giving out. But I don't know if you have that already, Mario.
It's
total daily.
Right now, average 7,400 tests.
Okay.
Yes.
Mayor, one last thing, just a shameless plug. I saw on your social media you shared a story that we ran last night. San Antonio couple who donated combined 19 times plasma. Your message to them and to others to donate.
And it was Dina. And I traded a message with her just to thank her. They've donated, I think, over a dozen times, and your count was they've saved 70 lives. So if you have recovered from COVID-19, it is within your blood to help save a life. And you can do that very easily by contacting the South Texas Blood and Tissue Center to find out if you're eligible to give plasma. If you are eligible to give plasma, you can save so many lives in our community just by a simple donation. And, you know, we would encourage you to do that. You can call Metro Health. You can also visit southtexasblood.org.
Thank you.